Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 1. Shock. Stages of shock. In addition to an understanding of the underlying pathogenesis of the type of shock that the patient is experiencing, monitoring and management are guided by knowing where the patient is on the shock continuum. This continuum begins with the initial stage of shock that occurs at a cellular level and is usually not clinically apparent. Metabolism changes at the cellular level from aerobic to anaerobic, causing lactic acid buildup. Lactic acid is a waste product that is removed by the liver. However, this process requires oxygen, which is unavailable because of the decrease in tissue perfusion. Shock is categorized into 3 clinically apparent but overlapping stages, namely, compensatory stage, progressive stage, and irreversible stage. Compensatory stage. The body attempts to overcome the increasing consequences of anaerobic metabolism and to maintain homeostasis. One of the classic signs of shock is a drop in blood pressure, which occurs because of a decrease in cardiac output and a narrowing of the pulse pressure. Progressive stage. The progressive stage of shock begins as compensatory mechanisms fail. Changes in the patient's mental status are important findings in this stage. The cardiovascular system is profoundly affected in the progressive stage of shock. Cardiac output begins to fall, resulting in a decrease in BP in coronary artery, cerebral, and peripheral perfusion. Irreversible stage. In the final stage of shock, the irreversible stage, decreased perfusion from peripheral vasoconstriction and decreased cardiac output exacerbate anaerobic metabolism. The accumulation of lactic acid contributes to increased capillary permeability and dilation. The patient in this stage of shock demonstrates profound hypertension and hypoxemia. The failure of the liver, lungs, and kidneys results in an accumulation of waste products, such as lactate, urea, ammonia, and carbon dioxide. The failure of one organ system affects several other organ systems. In this final stage, recovery is unlikely. Table 3 summarizes the manifestations of the stages of shock. Compensatory stage. Neurologic system. Oriented to person, place, time. Restless, apprehensive, confused, and a change in level of consciousness. Cardiovascular system. Sympathetic nervous system response, such as release of epinephrine/norepinephrine that results to vasoconstriction. Increased myocardial volume of oxygen. Increased contractility. Increased heart rate. Coronary artery dilation. Narrowed pulse pressure. And decreased in blood pressure. Respiratory system. Decreased blood flow to the lungs that results to increased physiologic dead space, increased ventilation perfusion mismatch, hyperventilation, increased minute ventilation, and tachypnea. Gastrointestinal system. Decreased blood supply, decreased GI motility, hypoactive bowel sounds, and increased risk for paralytic ileus. Renal system. Decreased renal blood flow, increased renin resulting in release of angiotensin, which acts as a vasoconstrictor. Increased aldosterone resulting in sodium and water reabsorption. And an increased antidiuretic hormone resulting in water reabsorption. Temperature is within normal or abnormal range, and skin is pale and cool, warm and flushed. Progressive stage. Neurologic system. Decreased cerebral perfusion pressure. Decreased cerebral blood flow. Decreased responsiveness to stimuli, and delirium. Cardiovascular system. Increased capillary permeability that leads to systemic interstitial edema. Decreased cardiac output that leads to decreased blood pressure and increased heart rate. Mean arterial pressure is less than 60 mm mercury or 40 mm mercury drop in blood pressure from baseline. decreased coronary perfusion that leads to dysrhythmias, myocardial ischemia, and myocardial infarction, and a decreased peripheral perfusion that leads to ischemia of distal extremities, diminished pulses, and a decreased capillary refill. Respiratory system. Signs and symptoms of acute respiratory distress syndrome, ARDS, such as increased capillary permeability, pulmonary vasoconstriction, pulmonary interstitial edema, alveolar edema, diffuse infiltrates, tachypnea, decreased compliance, and moist crackles. Gastrointestinal system. Vasoconstriction and decreased perfusion that results to ischemic gut, for instance, stomach, small and large intestines, gallbladder, and pancreas, erosive ulcers, GI bleeding, translocation of GL bacteria, and an impaired absorption of nutrients. Renal system. Renal tubules become ischemic that results to acute tubular necrosis, decreased urine output, increased blood urine nitrogen or creatinine ratio, increased urine sodium, decreased urine osmolality and specific gravity, decreased urine potassium, and metabolic acidosis. Hepatic system. Failure to metabolize drugs and waste products, cell death, increased liver enzymes, jaundice, decreased clearance of bilirubin, and increased ammonia and lactate. Hematologic system. DIC or disseminated intravascular coagulation, thrombin clots in microcirculation, and consumption of platelets and clotting factors. Temperature is hypothermia or hypothermia, and skin is cold and clammy. Irreversible stage. Neurologic system. Unresponsive, areflexia, or loss of reflexes, and pupils non-reactive and dilated. Cardiovascular system. Profound hypertension, decreased cardiac output, bradycardia, irregular rhythm, and decreased blood pressure inadequate to perfuse vital organs. Respiratory system. Severe refractory hypoxemia, and respiratory failure. Gastrointestinal system. Ischemic gut. Renal system. Anuria. Hepatic system. Metabolic changes from accumulation of waste products, for instance, ammonia, lactate, and carbon dioxide. Hematologic system. DIC or disseminated intravascular coagulation progresses. Temperature is hypothermia, and skin is mottled and cyanotic. Kindly click the next button for part 5. Thank you for listening. Have a good day, and be safe. Agyamanag.